Contacting your coordinator, your outpatient transplant coordinator. Please refer to the telephone list to determine who your outpatient coordinator will be based on the first letter of your last name. During business hours, weekdays 8 a.m. to 5 p.m., call your outpatient transplant coordinator at the phone number listed on the phone list for all non-urgent concerns. Your call will be returned within 24 hours. For an emergency during work hours or during nights, weekends, and holidays. If you have an urgent problem or emergency that requires immediate attention, you must contact your outpatient transplant coordinator or coordinator on call by calling the UCLA page operator at 310-825-6301. Ask the page operator to page your outpatient transplant coordinator or liver transplant coordinator on call. If your page is not returned within 15 minutes, you must call the page operator again and repeat the page. You should not page a coordinator for non-urgent issues, such as medication refills, making, changing, or canceling clinic appointments, or finding out about laboratory test results. These questions should be dealt with during business hours by calling, not paging, your outpatient transplant coordinator. Emergency department or re-hospitalization. If you are hospitalized at an outside hospital, you or your family member must notify your transplant coordinator or the on-call coordinator during non-business hours immediately so that we can guide your medical management and involve the transplant team in your care. If you are admitted to the following outside hospitals: Providence St. John's Health Center, Los Robles Hospital and Medical Center, West Hills Hospital and Medical Center, Northridge Hospital Medical Center, Henry Mayo Newhall Hospital, Torrance Memorial Medical Center, or Providence Little Company of Mary Medical Center. UCLA physicians are present at these facilities, and you may request to be seen by a UCLA physician by calling the UCLA Hospitalist Service at 855-884-4100. That's 855-884-4100. Differences between emergency and urgent matters. Go to the nearest ER or UCLA ER, only if safe to do so. Call 911 if not safe to take the time to get to the ER. Chest pain that feels like pressure or squeezing. Shortness of breath that is not relieved by rest. Heart palpitations, fast, irregular heartbeat that does not go away with rest. Severe abdominal pain. New onset bleeding, such as in your stool, vomiting blood, etc. Sudden numbness, weakness of arms and legs, or sudden changes in the ability to walk, move, and talk. Severe headache with sudden onset, fainting or loss of consciousness, changes in mental status, such as sudden disorientation or confusion, T-tube that has been completely pulled out or dislodged. These are emergency matters. Urgent matters. Call your doctor's office or page your coordinator. 4. Signs of wound infection, worsening redness, tenderness, swelling, pus, or foul-smelling drainage from incision or previous drain site. Nausea, vomiting, or diarrhea that does not get better. Fever greater than 100.5. Shortness of breath relieved by rest. Severe incapacitating fatigue. Symptoms of fluid retention or swelling, or sudden weight gain. Urinary tract infections. Symptoms such as urination that is frequent, painful, cloudy, or bloody. No bowel movement for greater than or equal to 3 days. T-tube suture that has come loose, or there is leakage from the T-tube site. And increasing abdominal bloating without significant pain. Ronald Reagan UCLA Medical Center is located at 757 Westwood Plaza, Los Angeles, California 90095. Please see the map and location. Parking location: 757 Westwood Plaza. Pull into the valet driveway at the main entrance of the building. This is valet only. For vehicle retrieval, take the east parking elevator from level 1 across from the meditation room down to level P for patient discharge. Patient escort provides complimentary parking for up to 30 minutes for patients discharged via the discharge lobby only. See the patient escort staff for validation information. Patient discharges taking longer than 30 minutes will receive a partial credit toward the daily parking fee on the day of discharge only. The liver clinic is located at the Flager Liver Institute. The address is 200 Medical Plaza, Suite 214, located on the second floor, Los Angeles, California 90095. To call us, please call your assigned coordinator if you cannot attend your clinic appointment. Clinic doors open at 7:30 a.m. and is based on a first-come, first-served basis. Surgical clinics and hepatology clinics are held at the same location, but on different days of the week. The liver transplant clinic is located in the Peter Morton Medical Building, 200 UCLA Medical Plaza. Please see the accompanying map. Outpatient Liver Clinic. The parking locations for the outpatient liver clinic are located in the 100, 200, and 300 Medical Plaza Way on Westwood Plaza north of LeConte Avenue. They can also be accessed by the Gailey Avenue access for 200 and 300 Medical Plaza parking. This is self-parking only. Pull the ticket at the entrance and take the ticket to pay at the pay station before returning to your vehicle. Before coming to the liver clinic, here is your checklist. Bring your morning and afternoon medications to take. Do not take immunosuppressant medications until after blood is drawn. Bring your updated medication list. If you are a diabetic, bring your blood sugar logbook. If you are on insulin, bring your insulin with you. Bring a written list of any questions you have. Bring something to eat and drink for everyone who is with you. Bring extra drinks and snacks, because the appointments can take a long time. Bring a book or something to occupy you as there is a long wait. Dress comfortably. Bring a sweater or a blanket as rooms may get cold. Bring a caregiver to be with you in the room during the time of your clinic visit, to ensure all of the information and plan for your care is understood. Also, bring any pain medication that you may require during your visit. Liver Surgical Clinic. This clinic is dedicated to those who have undergone liver transplants recently or have a surgical issue that needs to be followed. After you go home, you must attend the surgical clinic every Thursday for 4 weeks. If you are readmitted to the hospital, you will return to the clinic on the first Thursday after you return to your home until you have attended a total of 4 Thursday clinics. You may be required to have more than 4 Thursday clinics, depending upon your situation. Blood tests. Every time you come to clinic, you will have your blood drawn. Report to the lab before 6:30 a.m. to have your blood drawn. Then take your medications. This is very important. If you do not have your blood tests done early enough before your clinic appointment, your lab results will not be available by the time you are seen by your provider in the clinic. Eating breakfast. If you like, you may eat a light breakfast, then take all of your medications except your immunosuppressant medications before your blood is drawn. Or you may wait until your blood is drawn, then take all of your medications with food. After your blood is drawn, go upstairs to your clinic appointment. Please check in at the front desk of the clinic. The doors open at 7:30 a.m. The latest you can check in is 10 a.m. If you are late for clinic, you may not be seen. You will be seen by an outpatient transplant coordinator and a surgeon on a first-come, first-served basis. Post-transplant hepatology clinic. Once discharged from the surgical clinic, you will be followed in this clinic at varying intervals, lifelong, for routine follow-ups. Scheduling these clinic appointments. Your outpatient transplant coordinator will make your first appointment, but you are responsible for making all your future appointments at the front desk of the clinic as you check out. Contact your transplant coordinator to make, change, or cancel an appointment. If you receive HBig shots, you must also make your next appointment for a shot at the front desk of the clinic as you check out. After you complete your 4 Thursday surgical clinic appointments, you will transition to the post-hepatology clinic. Every time you come to clinic, you will have your blood drawn prior to the clinic visit unless otherwise instructed by your coordinator. You can have your blood drawn at UCLA on the morning of your appointment. You can have blood drawn at UCLA the weekend before your appointment. Post-transplant hepatology clinic continued. You can have your blood drawn at a non-UCLA lab near your home no later than the Wednesday before your scheduled appointment. The hepatology appointments are located at the same clinic location as your Thursday clinics, same building, same suite. 200 UCLA Medical Plaza, Suite 214. You will be in either Tuesday, Wednesday, or Friday clinic based on your assigned provider. You will be seen every 2 weeks and slowly transition to monthly, quarterly, then semi-annually, then an annual hepatology appointment. Your appointment frequency may change based on your current medical condition. In addition, you will have blood drawn on a regular schedule. Intervals are never longer than every 3 to 4 months, so that we can monitor your liver status between clinic appointments. We will provide you with a standing lab order to have your blood drawn near your home. The results of these lab tests should be faxed to 310-983-3570 so that we can examine them immediately. If you have not received a call within 1 week regarding your lab results, contact your transplant coordinator. Quest and LabCorp are preferred laboratories for local labs, as we are able to send orders to them electronically and easily obtain lab results from their system. Kaiser patients will follow up at Kaiser once released from UCLA. This is located at the 200 Medical Plaza, first floor. The address again is 200 UCLA Medical Plaza, Suite 145, Los Angeles, California 90095. They are open Monday through Friday, 6 a.m. to 7 p.m. Open weekdays and holidays, 7 a.m. to 3:30 p.m., except Thanksgiving Day, Christmas Day, and New Year's Day. Outpatient laboratory for blood tests continued. Outpatient laboratory information for off-campus. Patients must obtain approval to get blood tests performed at laboratories other than Westwood UCLA campus. This will be determined by your treatment team and will depend on factors such as clinical stability. UCLA health locations. A list of other UCLA laboratories may be accessed at the link below. Other laboratories commonly used. Quest Diagnostics. You may locate your nearest Quest Diagnostics laboratory and location and schedule an appointment by accessing their website at the link provided below. You may also place Quest Diagnostics in your browser and search for the closest laboratory to you to make an appointment for your next visit. Outpatient laboratory for blood tests continued. LabCorp. You may locate the nearest LabCorp laboratory location and schedule an appointment by accessing their website at the link listed below. The main number for LabCorp is 888-522-2677. Outpatient Pharmacies. Outpatient Pharmacy at Ronald Reagan UCLA Medical Center, located at 757 Westwood Plaza, room number B140, located on the B level, Los Angeles, California 90095. The telephone number is 310-206-3784. Press option 2. Their fax number is 310-206-5716. Their hours of operation are Monday through Friday, 8 a.m. to 9 p.m., Saturdays, 8 a.m. to 7 p.m., Sundays, 8 a.m. to 5 p.m. Outpatient pharmacies continued. Outpatient pharmacy at 200 Medical Plaza, first floor, is located at the 200 UCLA Medical Plaza, Suite 135, Los Angeles, California 90095. The telephone number is 310-206-3784. Press option 1. Their fax number is 310-794-1187. Their hours of operation are Monday through Friday, 8:30 a.m. to 6 p.m. Outpatient pharmacies continued. Pharmacies outside of UCLA. The use of pharmacies outside of UCLA may be required by certain insurance companies, or you may have a particular pharmacy preference. These issues should be brought to the attention of your transplant coordinator. You should always let your coordinator know of any changes to your pharmacy or prescription medication insurance coverage immediately. Insurance. If you change your insurance, please contact us immediately. We do not recommend that you change your insurance for at least 1 year after your transplant. If you lose your insurance, please contact us immediately. You must not miss taking your medications, having your blood drawn, or coming to clinic. If you lose your insurance, you're in a very dangerous situation that must be fixed as soon as possible. If you have Medi-Cal, please do not assign your Medi-Cal to an HMO. If you allow your Medi-Cal to be assigned to an HMO, you will not be allowed to come to UCLA for any medical care. Medicare. Do not enroll in MediConnect. Remain fee-for-service or enroll in Medicare Advantaged program accepted at UCLA. Contact your coordinator for guidance. If you receive any paperwork in the mail from Medicare or Medi-Cal, please contact your coordinator immediately. Primary medical doctor or PMD. Your primary physician will eventually resume responsibility for your health care needs that are unrelated to your liver transplant. So it is important that you resume your relationship with a primary care physician. If you do not have a primary care physician, your insurance company can identify one in your insurance network and geographical area. If you would like to see a UCLA primary care physician, you may choose one by calling the UCLA Physician Referral Line at 310-825-2631. Consultant physicians and specialists. You may require a follow-up appointment with various physician specialists over your lifetime, such as a diabetes or cancer specialist. Other specialists as needed based upon your medical needs. Cancer. If your transplant was for cancer of the liver, you will require lifelong follow-up and surveillance diagnostic tests. Please make sure you track your schedule and maintain all your follow-up appointments. Contact your outpatient transplant coordinator if you are unsure of your testing schedule. Medications prescribed by other doctors. Always talk to your transplant coordinator before taking any medications prescribed by any other doctors, as some medications can have harmful interactions with your immunosuppressants and your liver. Never take erythromycin or Biaxin or an aminoglycoside antibiotic because they can cause kidney damage. Never take aldactone unless instructed by your transplant team, as it can cause potassium in your blood to rise too high. Never take aspirin unless our liver doctors have prescribed it, or NSAIDs, non-steroidal anti-inflammatory drugs, as these will cause kidney damage. NSAIDs, including medications such as Advil, ibuprofen, Aleve, or Naproxen, are examples of these drugs. Always ask your outpatient transplant coordinator if it is okay to take any medication that UCLA transplant team did not prescribe for you. Dental visits. As you are now immunosuppressed, you will need to take antibiotics every time you undergo any type of dental work, including cleaning. Having regular dental checkups and maintaining good mouth care is very important after liver transplant. You must take antibiotics 1 hour before every procedure to assure that an adequate amount of the antibiotic is in your bloodstream. Your transplant coordinator or your dentist can also prescribe the correct medication for you. Call your outpatient transplant coordinator at least 1 week prior to your dental appointment to obtain a prescription for the correct antibiotic. Sun exposure. Your risk for skin cancer rises after your liver transplant due to the immunosuppression medications you take. Your immune system is less able to detect and destroy cancer cells. See a dermatologist at least annually to have your skin checked. You may need to be followed by a dermatologist more frequently if you have a suspicious skin spot or history of skin cancer. Always wear sunscreen with a sun protection factor SPF of 15 or higher whenever you are outdoors, even on cloudy days. Wear a hat, a long-sleeve shirt if you expect to be outdoors for a long time. Avoid staying in peak sun hours between the hours of 10 a.m. and 4 p.m. Travel. Please stay near UCLA after your transplant. We prefer that you not travel for the first 3 months. If your physician permits and your condition is stable, you may travel between 1 and 3 months all of California, Nevada, and Arizona. From 3 to 6 months, the Western United States. 6 to 12 months, the entire United States. Greater than 12 months, Canada, Mexico, and abroad. Always take extra medication with you in case your trip back home is delayed. If you plan to be gone for more than a month, please make sure that you let the pharmacy and your coordinator know ahead of time to ensure that proper steps are taken so that you can receive adequate medication quantities well ahead of your scheduled vacation date. Travel. Always pack your medication in your carry-on bags and never pack medications in luggage that will be checked in. There is always a risk of luggage being lost, so you should always keep your medications with you. We highly recommend not traveling to developing countries for the first year. However, if you are traveling to a third world country, drink only bottled water and avoid eating foods sold on the street, such as food stands or buffets. If you plan a trip outside of the United States, you can visit the UCLA Travel Clinic several weeks before your scheduled trip. Call to make an appointment. At the Santa Monica Travelers and Tropical Medicine Clinic at 310-319-4371 or the UCLA Westwood Travelers and Tropical Medication Clinic at 310-794-5583. Pregnancy and birth control. Pregnancy is possible after liver transplantation, but women who have had a liver transplant should wait at least 1 year after their transplant before conceiving. Men are able to father children after liver transplantation. Let us know if you are planning to start a family. Your immunosuppressant medications must be adjusted well in advance of conception. Close follow-up by an obstetrician specializing in high-risk pregnancies is required. If you are on CellCept or mycophenolate, please contact your coordinator prior to trying to conceive. CellCept causes birth defects. If you become pregnant while taking CellCept, contact your transplant coordinator immediately. Certain birth controls are allowed. Please ask your coordinator prior to starting one. Some oral contraceptive pills may cause blood clots, bile to clog up in the liver, and may contribute to hypertension or high blood pressure. Intrauterine devices such as IUDs should be discussed with your coordinator and hepatologist. Barrier methods such as condoms and diaphragms are safe and acceptable alternative to birth control pills and IUDs. Hepatitis B and C. Hepatitis B. Removing your old liver does not cure your hepatitis B. The hepatitis viruses live in your bloodstream, lymph nodes, spleen, and other places in your body besides your liver. The medications we prescribe for your transplant may prevent your immune system from fighting off the virus, and may even stimulate the virus to grow in numbers and damage your new liver. If you had hepatitis B, or in some cases even just prior exposure to hepatitis B, you will be given a medication lifelong after liver transplant to prevent any hidden virus in the body from becoming active. This medication will most likely be one of the following: Viriad or tenofovir disoproxil, or Vemlidy, tenofovir alafenamide, or Baraclude and Entecavir. You may also be receiving hepatitis B immune globulin injections, otherwise known as HBIG. HBIG supplies antibodies against hepatitis B virus. After HBIG is given monthly for 12 months, you may be transitioned to just a daily oral dose of medication. You are responsible for maintaining your HBIG appointment schedule. Hepatitis B and C continued. Hepatitis C. If you are not successfully treated and cured of your hepatitis C prior to transplant, You can expect it to infect your new liver at some point after your transplant. In most cases, hepatitis C only has mild effects on the liver and causes minimal damage. Most patients will feel and look well, and their only evidence of reinfection may be slightly abnormal lab tests. It may take many years for the hepatitis C virus to create enough liver damage for you to experience symptoms of liver disease. Your liver transplant team will decide when it is safe to treat your hepatitis C after your transplant. If treated successfully, you can be cured of hepatitis C. If you have been cured of hepatitis C due to these new medications, you can still be reinfected if exposed again to the virus. Hepatitis B and C continued. Hepatitis precautions. We check your blood levels of hepatitis B and or hepatitis C. If you have active viral hepatitis, your family members should be tested and vaccinated against it. There is no vaccine for hepatitis C. Safe sex, proper use of condoms or abstinence should be practiced because hepatitis B is often transmitted sexually. Since hepatitis C is transmitted through the blood, we recommend that family members not use the same scissors, razors, and toothbrushes as the patient, and that they practice safe sex using a condom. Contacting your donor family. Use your first name only. Use the state where you live, but not the county or city. Recognize the donor family's generosity and thank them for their gift. Describe how long you waited for a transplant and how the wait affected you and your family. Explain how the transplant has improved your health and changed your life. Describe the impact of your transplant on your own family. Explain what has happened in your life since the transplant. Mention if you are married, have children, grandchildren, etc. State your hobbies or interests. Do not include your address, city, or phone number. Do not include the name or location of the hospital where your transplant surgery was performed, or the names of your transplant health care providers. Use caution when including religious comments, as you do not know the religion of your donor's family. Contacting your donor family continued. When your letter is complete, place your card or envelope in an unsealed envelope. Include a separate piece of paper with your full name and date of transplant. Place these items in another envelope and mail them to your transplant coordinator. Your transplant coordinator's mailing address is the name of your transplant coordinator followed by UCLA Liver Transplant, 924 Westwood Boulevard, Suite 740, Los Angeles, California, 90095. Once we receive your letter, we will forward your letter to the Organ Procurement Agency, or OPO. Your OPO will review it and ensure confidentiality. The OPO will then contact the donor family to ask if they wish to accept correspondence from recipients. If the donor family does not wish to communicate, the OPO will inform your transplant center accordingly. If the donor family does wish to communicate, the OPO will forward your letter. Contacting your donor family continued. Confidentiality. There is no law that a donor's family and the organ recipient cannot meet and know each other's names, but all OPOs have policies to protect the privacy of both parties. Question: will I hear from the donor's family? Well, you may or may not hear from your donor's family. Some donor families may feel that writing about their loved one and their decision to donate helps them in their grieving process. Others choose not to write to the organ recipient. If the donor family chooses to respond, they will send a letter to the OPO. The OPO will then forward the response to you.